Copays in Wisconsin's BadgerCare Plus and Medicaid programs will restart on July 1st. Wisconsin had suspended collection of copays in its BadgerCare Plus and Medicaid program, effective for service dates January 1st through June 30th, 2020. This was before coronavirus. This included the new copayment for non-emergent use of the emergency room, originally scheduled to take effect February 1st, 2020, for childless adults. The rules will revert back to before that January 1st suspension on July 1st. Now, the temporary suspension was part of a planned system change that would ensure members enrolled in Medicaid programs were not charged premiums or copays that exceeded 5% of their income. This was a federal requirement called the 5% rule that about cost share. Now, Wisconsin did suspend its copays in its BadgerCare Plus and Medicaid program to try to address that 5% rule. It didn't do anything with premiums. But then coronavirus happened and premiums were suspended for several programs separate of this other federal guidance. But now we're at the end of that January 1st through June 30th suspension of copayments. Now we will start taking into effect new calculations of copayments and premiums to determine if somebody is paying more than 5% of their income for that cost share. So this means copays will resume for certain services like chiropractic services, durable medical equipment, hospital stays that are either inpatient or outpatient, and some prescription coverage, some covered over-the-counter drugs as well. Starting July 1st, some enrollees will have copays again for some prescriptions and some services, and there will be limits to the monthly copay that will be calculated as you go. It's dependent on your income and who in the household has copays. And monthly premiums will count toward that copay limit. So there will be a lot of math going on, which means staying in touch with your income maintenance consortium is going to be important. There are people who are exempt from copays after July 1st, 2020, and let's talk through that list. First of all, if you are children under age 18, you will not have copays for prescriptions or healthcare services. So children age 18 and younger will not have copays. Similarly, youth in foster care on their 18th birthday who enroll in BadgerCare Plus will not have copays until they turn 26. Other exemptions: tribal members, pregnant women, people in the Wisconsin Well Woman Medicaid program, nursing home residents, and people in hospice care. This will also include people temporarily enrolled through express enrollment will not have a copay either. Once they do sign up for full service Medicaid and do the full application, then the copays will attach. The monthly copay limit will stay the same unless someone has a relevant change, such as a change in household size, change in income. So once again, reporting changes in a timely manner is going to be very important to make sure that the math is correct on how much you owe in copays and out-of-pocket costs. When someone reaches their monthly copay limit, they will get a letter and will not owe any future copays for the rest of that month. This is something that is reevaluated every month. The Department of Health Services says it will track copay limits, copays made, and premiums paid. Individuals do not have to take action, but keep good notes. You're going to want to make sure you track what you are paying in premiums and copays yourself. Should there ever be a discrepancy, your notes will be important. What else can you expect? Letters. You're going to get letters from the Department of Health Service announcing the change. It's titled the About Your Benefits letter. Explanations of copays, explanations of limits, telling you when your limit is reached, telling you if it's not. Lots of letters, and individuals have already started receiving the first June letter about your benefits letter, and it's confusing because it's not going to clearly tell you about all of the individuals in your family. You're going to want to make sure you get that letter, you keep it, you understand it. If you have questions on it, there is contact information you can call. It will give some dollar amounts if a limit has been established for you for copays. It might also tell you if there is no copay limit. Everybody enrolled in BadgerCare Plus and Medicaid may see one of these letters, whether they have a copay or not. So make sure you read it and ask questions if it is not clear to you what the letter is communicating. Here are a couple things to note. These rules do not apply to people enrolled in the Medicaid Assistance Purchase Plan or to SeniorCare. Those premiums and copays may exceed 5% of an individual's monthly income. Those are two carve-outs in this 5% rule that we've been talking about. Let's finish up by talking about the $8 copay for non-emergent use of the emergency room. This is another provision that was implemented in Wisconsin but suspended from January 1st through June 30th, 2020. This will start up on July 1st, 2020. It's an $8 emergency room copay if you use the emergency room when it was indeed not an emergency. You will owe an $8 copay for each visit not deemed an emergency. Providers are required to collect this themselves. They are required to advise members of the copay, and if somebody does not feel like they can pay the copay, you don't have to pay to get the service, but the hospital or the provider should tell you where you could go for medical help where there is not a copay. Providers will collect these copayments for visits on or after July 1st, and this $8 copay will count toward that monthly copay limit. It's a lot of details and moving parts about copayments and premiums and how to calculate 5% of income. We share with you the ForwardHealth update that spells this out, but certainly there is contact information in this announcement and in the letters you are receiving from the State Department of Health Services where you can call and ask questions if you have them.